Hi everybody, welcome to Wellness Weekend. My name is Dr. Molly Patch, and I know we're having a lot of fun here with the sessions, and we're going to continue that. Here to talk about more of stress and sleep, right? Something we all need to learn about and help improve, right? Something we always have to work through in our life. So today we're going to explore the science, physiology, and clinical impact of can chiropractic care improve stress and sleep, understanding the neurophysiology behind rest and resilience. So again, my name is Dr. Molly Patch. I studied chiropractic at New York Chiropractic College. I really enjoyed my time there, and I wanted to make sure that I studied as much as I could because I wanted to be able to help whatever patient came through my door. In my time there, I got to do an honors remote clerkship at the Buffalo and Batavia Veterans Affairs Medical Hospitals. And through that time as well, I achieved many certificates. Again, I wanted to make sure I could treat whatever patient came through my door. Having a background in sports science, whole foods nutrition, trigger point therapy. I got a lot of tools in the toolbox to be able to help everyone that comes through the door. I also studied biology with a human biology specialization at Carlow University right here in Pittsburgh, so it's wonderful to be back to the home city of black and gold to serve the patients here. So again, today we're going to talk about stress and sleep. If we're stressed, we're not sleeping, right? And if we're not sleeping, we're going to be stressed, right? How many people here would say they got 8 hours of sleep last night? Seeing some heads shaking no. Anybody? All right, so I think we got something we can learn in this session, right? Would anybody say they might be a little stressed right now? It's holiday time, right? Doing all that holiday shopping, trying to get here in the snow and the cold. Stress, right? We're always working through it. Does anybody know any fun tips to help promote good sleep? Any fun tips? Anything at all? How about making sure the room is really dark, right? Do we know about that? We need the room to be dark. We need to not have as much light noise, we call that. Also, why we want to make sure we're not using our phone about an hour before bed. Who falls asleep looking at their phone? Someone's tattletelling on you. It's okay. Something we all work through, right? It's hard. But something we want to work on, right? That blue light can help disrupt the melatonin production naturally in our brain, right? That's the hormone that helps us to fall asleep and help us be tired, right? We want to make sure that we're able to work through that so that we can calm down and have a good night's sleep, right? Any other tips? How about we need to make sure the room is nice and cold, right? Anybody know about that? If we're too hot, it's hard to sleep, right? The body temperature has to drop for us to actually get into sleep cycles so that we can rest and restore ourselves. A lot of cool stuff here. Let's get into it. So as we started off, it sounds like we might have some people that follow into these categories here, right? We're going to talk about the impact of sleep deprivation. So in the U.S., approximately 1 in 3 adults do not get enough sleep. That's 84 million people. And honestly, I would probably argue that the number is higher. 32% report just general sleep disturbances, and 43.2% suffer from insufficient sleep, so not getting enough sleep. 50 to 70 million people suffer from chronic sleep issues and wakefulness disorders, and sleep deprivation can negatively impact mental health, physical health, thus increasing risks of chronic diseases and affecting cognitive function. Sleep is actually one of the leading causes of chronic diseases, as we're finding out. It is one of those key factors that is playing a part in all of these diseases that we're being affected by today. Basically, what this comes down to is we all need a little help with sleep, right? Maybe more than a little bit. And we want to make sure we're getting good quality sleep. So let's talk about that too. So how much sleep do we actually need? Does anybody know? Anybody know a good number? 8 hours, right? That's what we're always told, right? 8 hours, third of the day. We're up waking, we work 8 hours, we have 8 hours to ourselves, 8 hours we sleep, right? That's about true, right? When we're born, infants, toddlers, we need a lot more sleep. We're learning so many things. We need to make sure we're sleeping enough because we need to consolidate all those new memories, all those new motor functions, right? So as we age, that slowly decreases, though teenagers still need a lot of sleep and they're not getting it. But when we get to adults, yeah, we kind of settle in that about 8-hour range, right? Does anybody know that women actually need more sleep than men? Does anybody know that? Fascinating, right? How many people think women are getting more sleep than men with everything they have to go through? I'm seeing a lot of no's. Okay. I love the honesty, right? So women actually, we need more sleep, right, with all of the hormone changes. Men are lucky. They're on a 24-hour cycle, right? So they can go through about the same things every day. Women, we have some different challenges in our body that we have to work through. So we need a little bit of different sleep at different times. We're going to talk about that. It's really fascinating. So again, additionally, we need about an hour more of sleep than men do. And that can actually change depending on the type of cycle that we're, the time of the cycle that we're in. So in the follicular phase, days 1 through 14 is generally the best time for sleep, right? We get the best quality and the best quantity of sleep. Estrogen's low at this time, and followed by a gradual rise in that estrogen can help to boost energy and improve mood, which leads to better sleep. Higher estrogen helps with temperature regulation as well, which leads to more comfortable sleep. Ovulation around day 14 is still generally pretty good, but we're leading into the luteal phase, approximately days 14 to 28, which we can experience some sleep disturbances here. Hormone levels, again, drop dramatically before menstruation, which I'm sure a lot of people can realize is when we have the worst sleep. Again, due to PMS symptoms like cramps, bloating, mood swings, we don't get great sleep. Estrogen and progesterone both are at their lowest at this time, so it leads to lower energy, disrupted sleep. We might need an extra 1 to 2 hours during this time. So in general, how much sleep do we actually need, right? There's different phases of our sleep cycle that we want to talk about. In general, deep sleep, we need about 1.5 to 2 hours. Light sleep, between 4 to 6. And REM sleep, that's rapid eye movement. That's where we're dreaming, right? We need about 1.5 to 2 hours. We work through each of these stages multiple times throughout the night, right? So stage 1, kind of our lightest sleep schedule, the body starts to relax, right? Brain waves and eye movement slow. We're trying to calm the whole body down. Then we can move into stage 2. The body relaxes even more. Breathing and heart rate get even slower, and eye movement stops. As we move into stage 3, this is our healing and repair mode. So this is really important for anybody working through injuries. We want to make sure we're getting this sleep right. That's when the whole body heals itself. We go through so much in our day, we always need healing, right? But especially if we're working through a specific injury. This stage, we also have the slowest breathing rate, and brain waves, we experience more delta waves. That's going to be important. We're going to talk about that later. Stage 4 is when we have the rapid eye movement. Again, this is usually when we're dreaming. And the brain is very active, so we know we can have crazy, weird dreams, sometimes a little bit worse if we eat right before we go to bed, right? Different things like that can make this a little bit more disruptive, right? Dreaming is good, but we want to make sure it's a good experience, right? Let's keep talking about it. So again, we work through these cycles multiple times throughout the night, going through each of them. Each cycle itself is about 90 minutes where we work through those 4 cycles. Each time it increases a little bit more from that 90 minutes, right? And we want that to happen. We want each more, and that's how we get more of that deep, restorative, healing sleep. This is also why it's better to take 20-minute naps, right? 20-minute naps is really good to just boost cognitive performance, everything like that, because we're still in that lighter stage of sleep. As soon as we get a little bit beyond that 20 minutes into the 30-minute mark, we're getting into the deeper sleep, which then when we wake up from suddenly, it's why we feel awful. We think, I got 10 more minutes of sleep, right? I should feel better. This is why 20 minutes is ideal. If we need a little bit of a longer nap, again, we want to go for that 90 minutes because we get through one full sleep cycle. Deep sleep also helps to, again, release growth hormone for tissue repair. This is really important. And various studies have shown that athletes who get less than 7 hours of sleep per night have significantly greater risk for musculoskeletal injuries. So there's a really fascinating study that I want to talk about, and it's going to help kind of pinpoint everything together that we're working through. So this study was published in the Brain Sciences Journal, titled Neuroplastic Responses to Chiropractic Care, Broad Impacts on Pain, Mood, Sleep, and Quality of Life. These are all great things, right? We all want to work on those, right? All sounds good. Let's talk about it. So a few things in this study. What they looked at were people with chronic low back pain. So they took 76 participants, each with chronic low back pain of 3 months or greater in duration. The patients were between the ages of 18 and 60, and there was no pathoanatomical cause for the pain. So there was no fractures, no disease states, things like that. No one in the study that had a pain score of 7 over 10 was included, and they received chiropractic care 3 times per week for 4 weeks. Each treatment was about 15 minutes long, and the primary focus of the treatment was HVLA adjustments to the low back and the sacroiliac joints. HVLA stands for high velocity, low amplitude. So these are the traditional chiropractic adjustments that you see. Again, high velocity, low amplitude. So we're adjusting the joints at a high speed, but with lower force to have an impact on those joints and how the brain is processing everything. It's really, really cool. Let's talk about it. One thing that they knew going into this study was how chiropractic care can be used to improve central nervous function. So the central nervous system includes anything with the brain and the spinal cord. So everything goes back to there, right? And the World Health Organization recognizes vertebral subluxations as a biomechanical lesion. So vertebral subluxations are the areas of the spine that we adjust, right? So whenever we are assessing our patients, we're assessing the motion of the joints before we adjust. We call that joint play. The areas that aren't moving as well are considered that biomechanical lesion. So we want to get them moving better, right? When they're not moving well, we have altered afferent input from those muscle spindle fibers in the muscles that are around the spine. So basically it means we're not getting as much sensation in from our body around those injured areas. Again, this disruption causes impaired sensory motor integration and control. Basically, it all boils down to we can't move as well as we want, right? We all feel that whenever we have back pain, everything seizes up. We can't move. Why is that? It all goes back to the nervous system. This is something, again, that they knew going into the study, and they wanted to look at just how this affects the body. Another really fascinating thing they did in this study was they measured changes in the brain at the start of the study and at the end, and looked at what changes they could see. Throughout the study, they, again, studied before and after during the 4-week mark. And they noticed that there was increased sensory connections in the brain after those 4 weeks of chiropractic care. So adjusting had such a profound effect that the brain was talking better with itself. Each area of the brain is responsible for different things. Throughout that chiropractic care, those connections were made faster and better. Whenever this happens, we can have profound effects on the system as a whole. This helps to promote a calming effect on the nervous system. Again, whenever we're hurt, we feel it too, right? We're guarded. We're in that fight or flight, everything's wrong mode. So if we can improve these connections, we can relax, get to that parasympathetic rest and digest state. Another thing to note with this is that adjusting releases endorphins. This has a profound and positive effect on pain. And again, when we're not in pain, we sleep better, right? Adjusting also has been shown to lower cortisol levels, which is important. Cortisol is the stress hormone. And that is responsible for, does anybody ever wake up at 2 or 3 in the morning routinely every night? I would say everybody has. No one, we're being shy on raising our hand. That's because of cortisol. We have an extra surge of cortisol at that time, right? We're stressed. The body is just waking up. It's in go, 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 right? We want to help to calm that down. And this is something that study showed that chiropractic care can do. So again, they looked at different wavelengths of brain signals throughout the study, again at the start and at the 4-week end of the study, right? And it's really fascinating. So they took everyone in a whole and added it all together. So again, when we're looking at this, we want to see red means more active areas of the brain, right? Blue, we have decreased activity. Interestingly enough, whenever we do studies like this, patients that are experiencing depression have a lot of blue areas in the brain, right? We want to get that better. So again, we want this red, we want more active. And as we can see, the delta waves, this first one here, we have more active waves of those after the chiropractic care. Delta waves are responsible for deep sleep. We need to get to that point where we can have that deep restorative sleep. Again, theta waves, we get to that. We had a little bit more of that, the alpha waves as well. And interestingly enough, the gamma waves also increased significantly, and that's responsible for intense focus and concentration. So a lot of benefits, right? Not just sleeping, but we got more when we're active and awake during the day too, right? All good stuff. So how does this look in the brain, right? The study looked at how do we piece all of this together and the effects that it had. And the neuroplastic, so again, can we have a positive change on the brain through chiropractic care? After the study, they noticed improved joint position sense error, cortical processing, reflex excitability, improved reaction time, cortical sensory motor integration, motor control, upper and lower limb muscle functions, and positive changes with pain, right? Particularly those unpleasant feelings or catastrophizing. It's such a huge thing whenever we're in pain to get out of that cycle too. We feel it in the whole body, so we want to make sure that we can work on that so that we can sleep better and we can heal. And it doesn't affect every area of our life as well. And we are still discovering the multiple but profound effects chiropractic adjustments have on the human body. This is just scratching the surface, but it is so much wonderful, and I see it in my work every day in the patients that I work with. I can tell you story after story of people coming in, and this is their last resort, and this is the best as it's going to get, but we work through this and they have changes that they might not even realize or they might not even have thought, like sleep and like stress. But this is why it's so important to take care of yourselves and to take a full body approach in that as well. And we're going to talk about that. Some other things that we can do today to help with that. So again, what can we do to help improve stress and sleep? Few of my favorite supplements that we want to talk about to help support the neurotransmitters of dopamine and serotonin. So neurotransmitters are the natural messengers in the nervous system. They send signals from one nerve cell to another. It's how the body talks with each other, right? And serotonin plays a unique role in sleep, mood, intestine function, pain control, inflammation, right? Dopamine plays a role in cognitive function, memory, learning, and pleasure. Dopamine is essentially the reward hormone, right? For any rewarding experiences, we have dopamine in the brain. And certain nutrients and amino acids may help to balance the levels of these neurotransmitters by providing the cofactors that assist in the body's ability to manufacture these neurotransmitters themselves. So these two in particular, the calm day and the sleep time, are what I want to talk about. They both contain GABA, L-taurine, L-theanine, L-glycine, and vitamin B5 and B6. Sleep time also has 5-HTP and melatonin in it. So I really love these formulas together. Again, if we're experiencing a lot of stress through the day, and more of that stress where it's turning into that kind of constant anxiety where we're feeling that stress, we can't get out of that mode, right? What do? We can take Calm Day. This is going to help, again, promote those calming effects in the brain. If we add that in with sleep time, we can keep those effects going so that we can sleep better and heal as well, right? So again, with the sleep time, that also has the 5-HTP, which has been shown to help with insomnia, depression, and fibromyalgia, which is the chronic pain syndrome, right? Again, when we're not in pain, we're not sleeping well. Melatonin is that, we talked about this earlier, it's that hormone that's naturally produced in the body to help us with that circadian rhythm, right? Melatonin is secreted, but it can decrease as we age, right? And we have changes, so we might need a little bit of help with that. or if our lifestyle is changing too, we have that phone at night, we have that blue light, we might not be making the melatonin as much as we need to. We also experience changes like that in the winter time where we don't get as much sunlight. That can negatively affect melatonin production. So this is a good thing that we can take to help kind of get us back on a better routine with sleep, right? The priority is always sleep, right? If we're not sleeping, nothing's healing. So we want to fix that first before anything else. And one of my favorite formulas, if you have ever worked with me or been a patient of mine, I've probably said the words magnesium glycinate to you before. This is one of my favorite forms of magnesium. Magnesium is important in over 400 processes in the body. We need it for muscle control, for so many things, right? But this form is specifically important for sleep. It helps us with the melatonin to fall asleep. Magnesium glycinate helps us to stay asleep, so we get that deep restorative sleep. So this form here, again, it combines magnesium with the amino acid glycine to help promote relaxation by calming down the nervous system. This works through the GABA pathways. This continues to help support melatonin production, again, to help you fall asleep faster and then stay asleep, which improves sleep quality, especially for those that experience stress-related insomnia. So again, we want to work this in. If we're a little stressed, we can't calm the mind down, can't calm the body down. How do we help sleep? We need about 400 milligrams of magnesium a day. It's really great to get that in different forms. So I generally recommend about 200 of the magnesium glycinate at nighttime. And then we want to get the other 200 in other forms that can create a powerful connection if we get different forms in the body together. Again, we want to take this about 1 hour before we go to bed, so it gets a little bit in the system, but then we get the highest dose of that right when we're about to fall asleep. And again, the muscles in the body can't relax properly without magnesium. Without that, we can't clear out lactic acid, which builds up after we move the muscles. That's what leads to soreness. That's what leads to restless leg syndrome, right? Who's ever woken up with that? That it does not feel good. It's something we want to work through, right? So this is where magnesium comes into play. So again, this is my triple threat for stress and sleep, right? So again, we want to take that sleep time and that magnesium glycinate to help us fall asleep and stay asleep. But if we are prone to that little bit more of that stress, we just can't calm down, we can kind of split this up and again, have them do double duty and we'll have this triple threat, right? So I recommend taking 1 capsule of Calm Day in the morning. So this will help, again, support those neurotransmitters for the calm, relaxed state throughout the day. And then we get another capsule of that, but with the added sleep benefits. We're going to take that one an hour before bed. That's the sleep time. And also at that same time, an hour before bed, we're going to take the 2 capsules of the magnesium glycinate. This is such a huge, powerful combination here. Again, it's the triple threat. Does anybody here take omega-3s, omega-3 fatty acids? Got some people. It's good, right? There's a lot of benefits to it, right? It's recommended for cardiovascular health, hair and skin health, supports blood pressure to help keep everything within normal ranges. It also helps support healthy nervous system and organ function, joint and bone health, gastrointestinal, respiratory, immune system. Sounds like a little bit of everything, right? And that's because it is. Did you know, though, if we take it closer at night, it has the potential to help with sleep? You're already taking it, right? If we need a little more sleep, what if we try switching that again to that hour before bed? And this can help us get better sleep. Studies have shown that it can help to improve sleep quality and efficiency and to increase sleep duration. So we're sleeping longer and we're getting good quality sleep too. We also get more of that REM sleep, which is important, again, for memory consolidation and different things like that. And it's also been linked to a reduced rate of sleep disorders, especially sleep apnea, where our mouth is closing, our throat is closing, so we're not getting enough oxygen at night, which throws healing off everywhere, right? We do not wake up rested. Everything is thrown off with that. So this is a great place to start. Again, this has such profound anti-inflammatory effects, which is why it can have such a positive effect on sleep. So instead of taking the ibuprofen and the aspirin at night to help with that inflammation to sleep better. Has anybody ever done that where they take that each night? It helps them sleep, right? We don't want to get stuck on that cycle, right? It's too taxing on the body and the liver to have that in. So can we also have the benefit of anti-inflammatory but without those negative side effects? So if that's something that has helped you in the past, that ibuprofen, aspirin at night, can we switch this out for something else anti-inflammatory that's really healthy for the body? Likewise, the effects of vitamin D deficiency on sleep. So whenever we're deficient in vitamin D, which most of us are, especially, again, here in the winter time in Pittsburgh, we're
People go to hot tropical climates in the winter time.
your vitamin D has probably got the best of all of us, right? I think we put the money on that, right? Because you're winning, right? So you're not going to be suffering from the poor sleep quality, shorter sleep duration, increased risks of sleep disorders, and negative effects on hormone production. Joe will tell you, vitamin D is essentially processed like a hormone in the body, and it's connected to so many things. You want to talk about that for a moment?
They used to, when they discovered vitamin D, they named it vitamin D, but it's cholecalciferol, which is actually a non-steroidal regulatory hormone in the body. So therefore, it's not a fat-soluble vitamin. You can't take too much of it. It'll never be toxic in your body. That's a complete fallacy.
And the effects that it has on other hormone production. Do you want to talk about that as well?
Well, yeah, it's, and not only that, I mean, cholesterol and vitamin D are so intricately related. And everybody tries to lower their cholesterol. But then guess what happens? They lower their vitamin D as well. You can't make vitamin D from the sun without adequate cholesterol in your body, in your blood. So it's directly related.
And it's directly related to all of the hormones in the body,
Because
essentially.
that's the mother hormone.
It is
Everything starts from there.
goes down the chain. So that estrogen, progesterone, testosterone, everything. We need vitamin D. That's the missing link, right? It's also needed for calcium, magnesium balance to help with the bones and everything. So very important for all of my patients, but especially my women patients. Something we all have to face in the future is working through osteoporosis and osteopenia prevention, right? So we want to make sure that we're getting enough vitamin D. We have enough stores of it that it's actually in the body to help prevent those things, right? Another great thing is to lift weights, right? We want to make sure we keep those muscles strong because that added input helps to make sure the bones stay mineralized too. So a little added benefit with that as well. And again, most people are actually deficient in vitamin D, but especially in the winter, and that has shown to be a link to seasonal depression or those wintertime blues that we can experience at times. So this is a great thing that we can add in. As Joe said, it's so many benefits. Why not take it at night and see if it helps with sleep too? And with that, we want to make sure that we're coming up with a plan that is specific to you, right? So what nutrition and supplementation support do you need? We have a lot of great tools here at the World of Wellness, including our Allego scan and our partnership with Avexia Diagnostics. So the Allego scan is a really unique tool that uses spectrophotometry, which is a big fancy word for light again. So it's going to use light to essentially take a picture of the tissues on your hand. And the different wavelengths of light, whatever refracts back, can tell us what vitamins and minerals you're deficient in. Or sometimes we have too much, right? We can also look at heavy metal toxicity as well and see if the body is being loaded with different things, right? This helps us to come up with a plan that's specific to you. The one thing that I really love about the Allego scan is that to get into the tissues, it takes about 3 months or more for these vitamins, minerals, everything, especially when it's so distal from our body. So we're getting a really good long-term picture of our health, right? Whenever we do blood work for vitamins and minerals, it's a little bit more just a snapshot of what's going on in the body in that moment. Can we actually get those nutrients from the blood into the cells? This is where the Allego scan comes into play. And again, we use this, we sit down, we talk with you for an hour, go over your full health history, your symptoms. We put all those pieces together, right? The other thing that we can add in with our partnership with Avexia Diagnostics is we can order blood work for you at a very, very reduced rate. There are things that we want to look at to add into that puzzle, right? So do we want to look at the hormone levels, see how things are playing out for you? There are, different things like that. This is where we put all those pieces together. Again, the Ego scan and the blood work. We'll sit down with you, talk with you, come up with a plan to help you feel better, right? How does this align with your symptoms? And just because we've been working through something for so long doesn't mean we have to live with that, right? We can always work towards better. We can always work towards feeling better and taking care of ourselves. So again, what does your health plan look like? I am such a huge believer that every patient is unique in the office, right? So we have a lot of great tools, but what does it look like with you? And again, we're a team, so we want to work together to make these medical decisions. That's why I really love working here, because we get to spend more time with patients one-on-one to really see what they need. We're not just in and out. We're talking about your health history, working through everything. So can we add chiropractic care? Talk about all those profound effects that we talked about, right? See how that helps you. Can this be the basis of our care? Also adding in the nutritional support and supplementation specific to what you need. We can work on inflammation control in the body. We have a class 4 infrared laser here to help work through injuries. It is one of the best things that we have to penetrate deep within those tissues to break up inflammation. Again, we control inflammation. It has such a profound effect on sleep and on stress in the body. The body isn't a stress itself, right? We also have a sauna here to help with systemic inflammation. Other things we can do are look at sleep tracking and cycle tracking with the hormones, right? But sleep tracking with different health watches. So can we measure out different patterns of your sleep, right? Can we see where you need a little bit more help? Are we getting enough deep sleep? Are we getting too much deep sleep? Are we working through those cycles properly, right? What tips can we work through practicing good sleep hygiene? Coming up with a good plan for you that's consistent, right? The body does like consistency, so can we come up with a good routine that the body knows what to expect, right? So that at nighttime we start to wind down, we feel tired, we can fall asleep instead of having that racing thoughts all the time, or those 2 a.m. cortisol wake ups, can't fall back asleep, right? Can we work on a good routine for you? Working on sleep always pays dividends again. Whenever I work with patients and they've either been experienced multiple things for a long time, my first thing is we got to fix sleep. If that's on the list, we have to fix the sleep first, because nothing else will work. We're just going to be on this hamster wheel. So if we sleep, we heal, and then we can add in everything else to really get you where you want to go, right? We all have things we want to work on in our health, and that changes throughout time, right? It's whatever we need to work out now. So we want to make sure that we're prioritizing your own health needs and your sleep needs. Just a few of my references that I talked about today through my presentation. And I wanted to say a big thank you to everybody. I know that we wanted to say a big thank you to the team of WOW and everybody. They have my back so that I can have your back. But I know we wanted to take a moment to let everybody step up here. Whenever Joe gets back, we'll introduce everybody. But I also want to say thank you to you guys for being so attentive. And it's always fun to talk with an audience that's interacting. And it seems like we have some questions too. How about that? Yes, if you're having an issue with sleep, and if you're already taking those, it's worth trying to take it at night to see what positive effects we can have on sleep. So again, we want to take that about an hour before bedtime, let it get into your system, but it works synergistically with a lot of those other things. So yes, if you're taking them, a lot of great benefits. Let's try taking them at night, see how it helps your sleep. So yes. Does that answer your question? Okay. Any other questions right now? Mhm. Mm.
I think they're hitting some of the points that you mentioned, that it's not that they're running or chasing a cat, it's their body winding down and regenerating their nervous system.
That's fascinating. We need to, right? So the body is always about energy control and energy, right? So we have so much energy. We want to conserve that to the things that we really need, and it wants to prioritize that, right? That's why we have to, again, when we want to fall asleep, we want to lower the body temperature, less energy on the body. We want to, we're sleeping, or excuse me, we're breathing slower, everything like that. If we can conserve energy that way, then the body can switch to healing the nervous system and those nerves and the muscles, right? If we can't get into that relaxed state, that energy is being used for that and not for healing, right? So that makes sense too, that the dogs experience it. It's very similar to what we experience, right? We want to, again, conserve that energy so that we can heal. So very cool point. Thank you. Any other questions? Great question. So sugar is processed. Basically, it goes right from sugar to inflammation in the body. So we want to make sure that, again, we're controlling that sugar because if we have too much in the body, it's just going to run inflammation up rampant. And when inflammation is up rampant, we're going to have trouble falling asleep, staying asleep. Again, and we're going to have trouble healing everything. So yes, we do want to make sure we're limiting sugar. Whenever we do have it, we want to make sure we're eating it with some protein so that the body can process that easier. We don't have as much of the blood sugar spikes, so eating that with protein. And again, making sure that we're not having that as late at night. We get that extra surge of energy with sugar, things like that. So if that's going to keep us up, it's going to be really hard to fall asleep. So I know we always like dessert at the end of the night, but might have to eat it a little bit earlier, right, to help with that. So any other questions? Okay. I know that Joe wanted to take a moment to have the team come up and introduce themselves. So yes. But thank you to everyone who joined in online too. Always fun to have you guys here to learn as well, everyone in person. And don't forget to pick up your sleep time samples as well. We have some samples right around the corner. So it feels like sleep feels good, right? It does. So we want to make sure we get best quality that we can. So yes, make sure you grab your sleep time samples as well. Thank you for the patience. We're gathering the team. They've been really busy working here at the Wellness Weekend. But we do want to take a moment to say thank you to everybody. So
Are you all done?
with that, yes, Joe, we're
All
ready
right, let's hear
to
it for Dr. Molly.
introduce everybody.
All right.
So thank you.
Very good. So, we do have a great staff here, and they work extra hard. And as we said this morning, Jamie and I, they prepare for this event for a month ahead of time, and we couldn't do it without them. So, Brandon, Courtney, come on up.
Again, they always have my back so that I can have your
That's
back.
right.
So,
Let's
so
get them
thank
on
you, team.
camera. Come on in here. This is Courtney. This is Brandon. These are the guys that put this whole show together, and they start early and they stay late, and we couldn't do it without them. You guys have been here, Courtney. Well, how long? A year now? Over?
Around a year and a half.
Around a year and a half. See how time flies?
Yeah.
That's great. Brandon, about a year too, right?
A little over a year and
Little
some
over a
change.
year?
Yeah.
Okay. So when you see these shelves stocked and you got these samples out here and these decorations and they take care of you as fast as can be up here at the counter, this is the people that do it, and we couldn't do it without them. So big hand for these guys. And
Thank you.
Lauren,
Thank
we're
you to
missing
Lauren,
Lauren.
too. Yes.
She's on her break, but we'll get Lauren tomorrow.
Well,
All right.
well deserved.
And how about Philly Phil? Let's hear it for Philly Phil. Get in here.
Phil.
Philly Phil, this is the director, the producer, the editor, the cinematographer. Did I miss anything? Okay.
You keep adding them.
Yeah.
Yeah, every day there's something else. Yeah.
He does it all. But we do have a great team, and we want to make sure that everybody acknowledges it. So thanks for coming, everybody.
Thank you.
Thank you.
Thank you. Sydney helped me with my presentation.